going to be a short segment on the peripheral nervous system. We've talked about most of the cranial nerves already, so we're going to be dealing with the 31 pairs of spinal nerves predominantly. First off, let's briefly review the cranial nerves. Here you can see the cranial nerves coming off the brain stem. First off, of course, we have the olfactory, dealing with the sense of smell, the optic for vision, the ocular motor, the third cranial nerve, for movement of the eye and some of the pupillary reflexes. Then we have the fourth cranial nerve, the trochlear nerve, and this one also deals with movement of the eye. Then the fifth cranial nerve, the trigeminal nerve, dealing with sensation in the face, although it is a mixed nerve, so it does have some movement as well, connected to some muscles. And then the sixth cranial nerve is the abducens nerve, and this one is a motor nerve for the eye again. The seventh cranial nerve is the facial nerve, and this one has to do with the movement of the face muscles for expression. And then we have a little bit of sensory component to that too, which is for the taste buds. A few of the taste buds, mostly the back of the tongue. And then the eighth cranial nerve, the vestibular cochlear nerve, is dealing with the sense of hearing and the sense of balance. Then we have the ninth cranial nerve, the glossopharyngeal nerve, which deals with the taste buds and the muscles of the throat, so swallowing and the sense of taste. So again, it's a mixed nerve, both sensory and motor functions. The vagus nerve runs all the way from the brain stem there on the medulla and goes all the way into the thoracic and even the abdominal cavities, and it brings the parasympathetic innervation to those cavities of the body. And then we have the 11th cranial nerve, the accessory nerve, and this helps to control movement of the shoulders and the neck muscles. The 12th cranial nerve is the hypoglossal nerve, and it has to do with muscles of the tongue, so speech and that sort of thing is affected by the 12th cranial nerve. For the 31 pairs of spinal nerves, we have the different regions named after the areas of the vertebral column that they exit the spine at. We have the cervical region, the thoracic region, the lumbar region, and the sacral, and last of all, a coccygeal nerve that exits the very bottom. There are 8 cervical nerves coming off around the vertebral bodies of the cervical vertebra, and then there are 12 thoracic nerves, 5 lumbar nerves, 5 sacral nerves, and 1 coccygeal nerve. The cervical region forms 2 plexuses, the cervical plexus and the brachial plexus, which we'll see in a minute. The thoracic region does not form any plexuses and innervates only the same muscles and skin at the level that it exits the spinal cord. The lumbar region forms plexuses, as well as the sacral region does, and the coccygeal nerve helps to innervate the area right around the coccyx and in the pelvic region. Here we can see the cervical plexus, and it includes the cervical nerves C1 through C5. These nerves form some terminal nerves. As you can see, the greater auricular nerve is one of those, the lesser occipital nerve. The greater auricular goes up around the ear, and then the lesser occipital to the back of the head. We have the transverse cervical nerve that goes right underneath the chin. We have the ansa cervicalis, which then goes to the muscles such as the omohyoid, the sternohyoid, and the sternothyroid muscles that are kind of the anterior part of the neck there. And you can see the supraclavicular nerves that are going down to the skin just above the clavicle. And these are the nerves that are the terminal branches of the cervical plexus. Moving on down now, we'll look at the brachial plexus. The brachial plexus includes the spinal nerve roots of C5, 6, 7, 8, and T1. Your textbook, Sigan Adams, on page 74 has a nice diagram as well if you want to open to that to follow along. As these nerve roots exit the spine, they divide into an anterior and a posterior rama. You can see it here labeled as the dorsalis ramus on C5. It immediately goes back and innervates the posterior region of the joint capsule and the skin right behind the spinal column there. The anterior ramus continues on to form the brachial plexus. So the branches, the first 5 branches there, are the anterior rami of C5 through T1. A number of small nerves branch off, going to muscles that usually they're named for. So if you wanted to have a good look at that, you could see which nerves innervate those muscles in that region. The thoracodorsal nerve is an exception, and it goes down on into the thoracic cavity. After the branches, we have the trunks. The trunks are joining together of the nerve branches. So first of all, C5 and 6 join together to form the superior trunk. C7 continues on as the medial trunk. C8 and T1 form the inferior trunk. Now they divide into anterior and posterior divisions or parts. The anterior parts form the lateral beam or the lateral cord. The posterior divisions form the posterior cord or beam, and the inferior trunk forms, the anterior branch of that one, forms the medial cord. Now these cords or beams divide up to form the terminal nerves, and I want you to focus mostly on these terminal nerves. The musculocutaneous nerve innervates the upper arm. The axillary nerve innervates the deltoid muscle. The radial nerve innervates the muscles of extension, such as the triceps and then the extensors of the wrist and the posterior skin of the hand. The median nerve travels down to the flexor muscles of the forearm, and it innervates the thumb and that side of the hand. The ulnar nerve innervates the ulnar side of the forearm and the pinky finger and part of the ring finger. Here we have a map of the dermatomes. And basically a dermatome is just an area of the skin that's innervated by a specific nerve coming off the spine at a specific level. So you can see here that all the thoracic nerves, shown here in blue, are coming off and innervating portions of the skin at the level that they exit the spine. There's no plexus is formed by the thoracic nerves. You can see that the cervical nerves formed the plexus and entered the arms, etc. The lumbar area for the anterior part of the legs, and the sacral region mostly dominating the posterior part of the legs and the gluteal region. Here we have the lumbar plexus, and I'm just going to read you the names of some of the nerves coming off the terminal branches there. We have the subcostal nerve coming off underneath the 12th rib. We have the iliohypogastric nerve, which goes to the region, the upper part of the abdominal wall. The ilioinguinal does the lower part of the abdominal wall. The genitofemoral nerve goes down into the pelvic cavity. The lateral femorocutaneous nerve then innervates the skin of the lateral part of the thigh, and it can be impinged during pregnancy or with severe obesity, and people can feel like a lack of sensation over the lateral part of their thigh. The obturator nerve goes in and does the pelvic floor muscles, and the femoral nerve takes off underneath the inguinal ligament into the femoral canal, and then it innervates the quadriceps muscles. Here we can see the sacral plexus illustrated. So we have some of the lumbar nerves contributing here, L4, L5, and then S1 through 4 that contribute branches to the sacral plexus. We have a few small nerves that come off the plexus, the superior gluteal and the inferior gluteal nerves going to, of course, the gluteal muscles. The posterior cutaneous nerve of the thigh, again, cutaneous means that it's going to be helping out with sensation in the skin in that region. The perforating cutaneous nerve, again, a cutaneous nerve that's going to be helping with sensation in the posterior part of the thigh. And then the pudendal nerve. The pudendal nerve is a very important nerve for the pelvic floor region, and if it's damaged, it can cause a lot of pelvic pain, and it's a very important nerve as well. Now, the main nerve, of course, that we want to, one last little nerve to look at here quick, the obturator internus and the quadratus femoris nerves going to the muscles they're named after. Then we have, of course, the sciatic nerve, the main nerve that's coming out here. It pops out underneath the piriformis muscle, or sometimes right even through the piriformis muscle, which means that it has a lot of chance to be impinged if there is a spasm in the piriformis muscle itself. It then is traveling posteriorly down the back of the leg, innervating the hamstrings, etc., and then going down into the behind the knee, and then the common peroneal nerve branches off there and does the lateral side all the way to the foot, and the tibial nerve does the anterior and the medial side all the way down to the foot. So here you have basically all the innervation to the leg, except for the femoral nerve, which does the quadriceps muscle anteriorly. Here I just wanted to look at a few of the main impingement sites for the peripheral nervous system. And by impingement, I mean pressure on a nerve, which often causes severe pain, numbness, tingling. Oftentimes people will refer to it as radiating pain in the areas that those nerves innervate. So here, first of all, we see the sciatic nerve coming out, like we said, right below the piriformis. On the other side of the body here, you can see that the gluteal muscle covers the whole region. So here it's been taken off, and we can see the piriformis muscle with the sciatic nerve coming out. As you can imagine, if the piriformis muscle or some of these obturator muscles below that are tight, they could easily compress the sciatic nerve there. Carpal tunnel syndrome, as you can see illustrated here, occurs when the tendons or the ligaments that travel through the wrist alongside the medial nerve become enlarged or inflamed because of irritating activities that they've been engaged in, such as typing or repetitive gripping activities. Often people's jobs include a lot of those, and they can be predisposed to carpal tunnel syndrome. Some other things that help to predispose people to carpal tunnel syndrome are pregnancy, because a lot of fluid is retained during this time, and diabetes and obesity. So these people are at higher risk. Massage therapists can play a large role in treating people for carpal tunnel syndrome. The last region we're going to, condition that we're going to be talking about is the thoracic outlet syndrome. In this condition, we have the entire brachial plexus and brachial artery being compressed, either as they're exiting through the scalene muscles, underneath the clavicle, sometimes between the clavicle and the ribs. This area is very tight. Either people have extra ribs, or just the positioning and the posture that they maintain causes much compression in that region. Pectoralis minor, as you can see here, could be tightened and cause impingement. So the symptoms for this are severe pain and tingling, numbness throughout the entire arm, because of course the brachial plexus innervates all of that region. And people who suffer from this definitely can benefit from treatments from massage therapists.